In this video, I'm going to demonstrate how to measure certain key dimensions in the lower extremities. We're going to start by looking at relative injury of the tibia. And when the tibia is injured through direct impact or a lower extremity strain, like an ankle sprain, for example, will be transferred up into here. We often see evidence of that by an expansion in the long axis. And that's one of the measurements we're going to be looking at. And another injury, which is very common, which we'll also be looking at, is injury to the upper portion of the tibia and the distal portion of the femur and the patella, which results in a widening or expansion of the tibial plateau, the proximal epiphysis of the tibia, and the distal epiphysis of the femur and the patella itself. So those are measurements we'll be looking at as well. To observe the length of the tibial shaft, we're going to have our patient supine. We're going to be standing at the foot of the table looking up towards the head. And we're going to bring the feet into alignment, making sure that they're equally positioned on the table. So they're flat on the table, and that the tibia is relatively vertical with respect to the table as well. Then we're going to position ourselves so that we are looking directly at both tibia, and then we're going to locate the landmarks for the tibial plateau by locating the soft spot just at the knee joint on the medial aspect of both sides. And then we're going to place our fingertip, index finger for example, on that ledge of bone just below that soft spot on both sides. And then using our fingers as levels, just rotate them 90 degrees so you're looking at it almost like you're looking at a level, like that. So you can get a relative size difference just by observing, okay, from both sides. You line up your eyes so they're positioned equally. Don't be deceived by the height of the femur, because there can be an injury on one side, for example, that causes an expansion of the femoral epicondyles, which makes it look like the leg is longer on that side, but it's not really the tibia that's involved. It might be an expansion of the femoral epicondyles and condyles. All right? Okay, so then what you want to do is make a mark. If you want to be more precise, you can actually mark that ledge of bone using a China marker on that level. You can see a little mark here, and then we can place a similar mark, find that ledge of bone as close as possible to there. So you have a slight mark you can make on both. That's going to be your reference point for measurement. Then you can take your tape measure, just separate the feet just a little bit, take your tape measure, and then use that to measure the distance from the inferior aspect of the medial malleolus. Line up your tape as a 0 point here, and then record your measurement here on one side, and then compare it to the other. So you have the visual reference, which is relatively showing the size difference, and then specifically measuring with the tape. Those are the two options. The next thing we want to look at is the width of the tibial plateau. Okay, so this is the proximal epiphysis of the tibia. For that, we have a couple of options. One, we can use our fingers to line up the relative width and use our thumb and maybe middle finger or index finger, probably the middle finger, to get a wider reach. Go to the widest portion of the tibial plateau. Then holding that in position, trying to keep that locked in, transfer that to a piece of paper, which you should have handy, and then place that on the paper, and then use your marker just to record exactly where the inside mark is on both sides. So record by drawing lines like so, and then you can measure that distance. And then do the same thing on the opposite side and get a width for that. And then you can, afterwards, then you can compare the distance between those two marks and record your measurement, like so. The same principle can be applied to the femur. Same idea. okay, transferring that over. And the same thing with the patella, which we'll show in a minute. The other option is to use the caliper which you have been provided with. These are fairly inexpensive calipers available, which we've provided to you. And for that, then you can line up your fingers on the epicondyles of the tibia or the femur, and then try to get as close as possible with your calipers to record that measurement. Just note where that is and write that down so you get a little more precise here. And for the patella, for that I would recommend we have the legs extended, right? So we're going to have them all the way down like that. You can support it on a pillow if necessary, but you can just go ahead and go right on the margins of the patella, and you can just line up your caliper quite precisely in line with those landmarks, the widest portion of the patella, and compare both sides. This will give you an idea of the impact of literally injuries to this area, very commonly experienced with direct impact to the bone, sometimes in the lower extremity and the tibia. You'll see that with a bad ankle sprain as well. So this is transferred into the bone and demonstrating the evidence of bone expansion, which is something we've noticed as part of what we're trying to recognize in the body and also correct with our technique. So thanks for listening, and we will talk to you soon.